Have you ever wondered why, as we get older, everything starts to look like we're seeing it through frosted glass? The reason is simple. Your eye works like a camera, and the lens is its lens. When the lens is clear, light focuses perfectly on the film, your retina. But when that lens becomes cloudy, the picture turns blurry. This clouding is called a cataract, and it's the #1 cause of blindness worldwide. So what exactly is a cataract? It's when the proteins in your eye's lens start to break down and clump together, turning the lens from clear to cloudy. Light can't pass through properly, so your vision becomes blurry, dim, or faded. Common symptoms include gradual, painless vision loss, sensitivity to light, dull colors, double vision, and especially poor night vision. Who gets cataracts? The most common type is age-related. It usually starts after age 50, peaks between 60 and 80, and by age 80, nearly everyone has some degree of lens clouding. But there are other types too: congenital, in babies, traumatic, metabolic, like from diabetes, or drug-induced, like from long-term steroid use. These can happen at any age. So while age is the biggest risk factor, cataracts aren't just an old person's disease. Now, how is it treated? Surgery is the only real cure. No drops or pills can reverse a cloudy lens. The standard procedure is called phacoemulsification, with intraocular lens implantation. It's done under topical anesthesia and takes about 10 to 20 minutes. Here's how it goes. First, a tiny incision, about 2 to 3 millimeters, is made at the edge of the cornea. Second, a small probe is inserted to break the cloudy lens into tiny pieces using ultrasound, and those pieces are suctioned out. Third, a folded artificial lens is inserted through the same tiny incision. It unfolds and locks into place inside the lens capsule. Fourth, the incision is so small that it seals itself, no stitches needed. It's minimally invasive, painless, and recovery is quick. Most patients can go home the same day. What about the results and success rate? The blindness-free rate is over 90%, and the overall success rate is above 95%. Most patients experience significant improvement in vision. However, the final outcome also depends on the health of your retina and optic nerve. If those are already damaged, your vision may not fully recover. Now, let's clear up some common myths. Myth #1: you should wait until the cataract is completely mature before surgery. Actually, the harder the lens, the more difficult and risky the surgery becomes. If your vision is affecting your daily life, it's time to see a doctor. Don't wait. Myth #2: eye drops can cure cataracts. No drops have ever been proven to reverse lens clouding. Surgery is the only effective treatment. Myth #3: I'm too old for surgery. As long as you're generally healthy, age is not a barrier. Many elderly patients get excellent results. So don't be afraid of cataracts. The surgery is safe and effective. If your vision is starting to interfere with your daily life, go see an eye doctor and get a proper evaluation. Don't let fear or misinformation delay your treatment. Clear vision is within your reach.